Hey, I'm James, and in this video I'm going to discuss the anatomy of the bony pelvis. This video is aimed at those who are wanting an introduction to this anatomy or are after some revision content. Subscribe to Geeky Medics to be the first to know when we release new videos. The osteology of the pelvic girdle includes the two coxal bones, or pelvic bones, and the sacrum. As you can see, the sacrum articulates with the two coxal bones laterally. The two coxal bones articulate anteriorly here, though this joint is not included on the model at the moment. The coccygeal bones do not form part of the pelvic girdle, but it makes sense to include them on the model here, as this is a site of attachment for muscles and ligaments that are described in subsequent pelvic videos. For the next few minutes, I'm going to focus on each of the individual bones, and we'll focus on key landmarks. The coxal, or pelvic bone, is a large, irregular bone formed by three separate bones: the ilium, ischium, and the pubis. In childhood, these bones are connected by cartilage, but form one complete bone in adults. The coxal bone is quite difficult to appreciate on a 2D screen, so I will just rotate the model to view the bone from a more posterior aspect, just so we can appreciate the shape of the coxal bone better. The principal point of attachment of the bones is at the acetabulum here. This is where the head of the femur articulates with the pelvis. So let's start with the ilium. The ilium can be described as having two parts: a large upper portion and a smaller lower portion. It is the most superior of the coxal bones and is the one most easily palpated at its most superficial points. In fact, the parts of the bone that you'll most easily be able to palpate on yourselves is the iliac crest, which runs between the iliac spines. The summit of the iliac crest is an important landmark, as it is level with the fourth lumbar vertebra in adults and can be used as an accurate method of numbering the lumbar vertebra, which has implications for spinal surgery or intervention. The anterior superior iliac spine is the most anterior endpoint of the crest. Once again, this is an easy landmark to palpate. This landmark forms attachments for structures like sartorius, a muscle of the lower limb, and the inguinal ligament. Here is the anterior inferior iliac spine. This is where rectus femoris attaches. The posterior superior iliac spine is where the iliac crest ends posteriorly. This bony structure forms dimples on the overlying skin, which can be used to approximate the sacroiliac joint. The gluteal surface is the attachment site for the gluteal muscles. This notch in the bone here is the greater sciatic notch. I will touch upon this later on in the video. The sacropelvic surface is where the sacrum articulates with the coxal bone. The posterior superior iliac spine is here, so you can see how it can be used to approximate the sacroiliac joints. Here is the concave iliac fossa on the anteromedial aspect of the bone. This is an attachment site for iliacus. The next bone on the list is the pubic bone, which articulates with the iliac bone at the iliopubic ramus. Key landmarks include the superior pubic ramus, inferior pubic ramus, and pubic tubercle. As you can see, the superior and inferior pubic rami form boundaries around this big foramen, which is known as the obturator foramen. The pubic tubercle is the other attachment site for the inguinal ligaments. Other key landmarks of the pubis include the pectineal line and the symphyseal surface, which is where the pelvic bones articulate anteriorly. The ischial bone is the most inferior of the three bones that form the coxal bone. The ischium articulates with the ilium superiorly and the pubis anteriorly. Key landmarks include the ischial ramus, which articulates with the inferior pubic ramus. Here is the ischial spine that forms a boundary between the greater and lesser sciatic notches. The ischial tuberosity is sometimes called the sit bone, as this is the part of the pelvis that we sit on. If we rotate the model, we can see the spine and the tuberosity more clearly. I will talk about the spine and the tuberosity later on in this video when I move on to talk about some key ligaments. Just before I move on to the sacrum, I will turn on the parts function on complete anatomy so that we can clearly see the greater and lesser sciatic notches, as well as the obturator foramen. So now I will add the sacrum and will remove the coxal bone so that I can briefly describe the sacrum. The sacrum forms part of the vertebral column. It consists of 5 fused sacral vertebrae. It is wide superiorly at the base of the sacrum and converges inferiorly to form a point at the apex. The anterior aspect is the pelvic surface of the sacrum. The lateral surface articulates with the coxal bones. On this lateral view, it is also possible to see the sacral promontory. On the dorsal surface, we can see the spinous processes of the sacral vertebra and the posterior sacral foramina. I will add the coxal bones back in now, just so that we can talk about some key definitions. The pelvis is often described as having greater and lesser, or true and false portions. The greater or false portion is the part of the pelvis superior to the pelvic inlet, which is the opening here. In this part of the pelvis, we would find structures such as the abdominal viscera. The lesser, or true pelvis, is inferior to the pelvic inlet. Here we would find the pelvic viscera. Now time for some connective tissue structures. Like I said before, the coxal bones articulate anteriorly at a joint called the pubic symphysis. It is the most anterior aspect of the pelvic girdle and is an important landmark because it forms the anterior boundary of the pelvic inlets and outlets. Here we can see the anterior sacroiliac ligaments that strengthen the sacroiliac joint anteriorly. The posterior sacroiliac ligaments are also included on the model, which strengthen the sacroiliac joint posteriorly. Other key ligaments include the sacrospinous and sacrotuberous ligaments, which are now on the model. These ligaments close off the sciatic notches, so with the ligaments in place we have the greater and lesser sciatic foramina. Like I said before, the pelvic inlet is used to demarcate the greater and lesser pelvis. The inlet is marked by the sacral promontory posteriorly, the pubic symphysis anteriorly, and the iliopectineal line between the two. It is an oval shape in females, but in males it is more of a heart shape. The pelvic outlet is a diamond-shaped opening marked by bony and connective tissue structures. Posteriorly, the point of the diamond is the coccyx. The lateral margins are formed by the sacrotuberous ligaments, the ischial tuberosities, and the ischiopubic rami. The anterior point is formed by the pubic symphysis. This opening is comparatively larger in females compared to males. The pelvic outlet is divided into anterior and posterior triangles by an imaginary line between the ischial tuberosities. The anterior triangle is the urogenital triangle, and posteriorly is the anal triangle. I will try and remember these terms, as it will help when learning about the perineum. When we further compare their female and male pelvis, we can see that the female pelvis is shorter and wider, the greater pelvis is shallower, the lesser pelvis is wide and shallow, and the subpubic angle is larger.